Hello, friends. So you've probably all heard of the Avengers. It's this team of superheroes whose job it is to protect ordinary citizens from all kinds of villains and threats. And primary care kind of reminds me of the Avengers, superheroes protecting their patients from health and healthcare related villains and threats. Well, today, instead of the Avengers, we're going to be talking about the aggregators. This is a rising trend in independent primary care. And aggregators are these entities that organize independent primary care practices into network groups, typically to help those practices be successful in value-based payment contracts. The problem they're seeking to solve is that the migration away from fee-for-service payment models to models that financially incentivize value has proven very, very turbulent for primary care, and so therefore adoption has been slow. So the aggregators are stepping in to try to address this in a novel way. And today we're going to be talking to an expert who can help us understand why aggregators and networks are necessary, how they are impacting primary care, and how technology can help drive value for aggregators and the primary care practices in their networks. So without further ado, let's kick off the show. Hello, and welcome to The Pulse, the Elation Health on-demand interview mini-series discussing hot topics across primary care, health tech, and the healthcare landscape. I'm your host, Dr. Sarah Pasteur, family physician and Senior Director of Primary Care Advancement at Elation Health. The topic of today's interview is primary care networks, reinventing value-based payment success. Today's guest is my colleague and friend, Nick Dealtry. He currently serves as the Senior Director of Network Growth at Elation Health, where he is spearheading Elation's growth motions and partnerships across the fast-growing value-based care enablement space in healthcare. Prior to Elation, Nick held roles in technology consulting and sales positions in the technology sector. He finds passion in being part of a company that is delivering on the promise of empowering the physician-patient relationship, having seen firsthand how Elation is improving care for his own family members with their personal physician who leverages Elation in their clinic. Outside of the virtual office, Nick enjoys snow sports, scooter rides across San Francisco, a classic San Francisco park day, and spending time with his wife and family. Welcome, friend.
Oh, excited to be here. Thanks for having me. That was a fun bio.
Fantastic. I think this is going to be a fun chat because you're the guy that brings the energy. So really excited to talk to you about this topic and what you do. And I thought that maybe we could start with kind of your superhero's origin story at Elation and kind of your character arc, because you've been at Elation a long time, right?
Wow. Yes. Wow. And no pressure now too. I gotta stay excited here. Take another sip of my coffee. Yeah, I know it's been a long journey. I'm coming up on 10 years, almost double digits here in a couple more months. So um, it's been a fun ride.
Amazing. So can you tell me a little bit about the iterations of your role over the years? How did you start and how did this?
Yeah.
I feel like you've been through a lot of different permutations of what you contribute to Elation.
Yeah, no, I know. Where do I start? Worn many different hats over the years. Um, yeah, I mean, early days, benchmarking our early kind of production metrics as our first salesperson. That was quite an adventure going from working with business executives and system administrators more on the IT side to then working with staff and physician owners of small clinics was certainly the learning curve. I digress here on a separate topic, but remember when I first started, it was almost 10 years ago, we had a very small office, and we had our co-founders, and then a handful of team members were basically building, right? Product developers building the product. Then we had like two of us were actually ones doing a lot of the external facing on the phones. And so nerve-wracking, some of those first calls and meeting physicians and talking to them about the challenges they have and introducing Elation and where we're able to solve some of that pain. But you're doing that in a really small office on the phone where everyone can hear every word you're saying. And being, so nerve-wracking, right? If it goes well, high fives. Didn't go well, you've got crickets and your co-founders are right behind you. You're going like, oh, geez, okay.
Wow,
That
but it was high
was,
pressure environment.
yeah, but you learn quickly that way, and obviously very rewarding, working with a really small team from the early days to where we are now, almost 300 employees. So very exciting. Those were the early days. As Elation continued to expand, I led much of our efforts in growing our early regional growth strategy. That's actually one of the areas I'm most proud of, is our growth in our really dense market of Hawaii. There's so many lasting and meaningful relationships that we built there. I've built there. It's a really special community. We continue to go up market. I managed some of our early enterprise sales, led some go-to-markets on some early kind of product service releases. And what may be most relevant for, I think, the rest of today's conversation, most likely, was the work over the last couple of years to support a key partner of ours' efforts to stand up a risk-bearing medical group. I had a chance to work very closely with the CEO and leadership team, really embedded into their operations and help them launch in their first market, and engaging our physician network to really recruit, identify candidates, speaking to them about the opportunity, working with them to evaluate joining a true physician-led, physician-owned medical group. So that was really exciting strategic work, and morphed into what I'm doing now and leading more broad partnership efforts with similar groups and physician networks that are looking to solve similar challenges and drive value across the healthcare spectrum. So yeah, it's been a fun ride.
Okay, so you're mentioning physician networks, which is the topic of today, and maybe you can help those of us who aren't as familiar with that term, which I think we sometimes use the term aggregators. Not sure what the right industry term is for this, but high level, what are these physician networks, or I guess primary care networks is what they really are? And why are they so necessary for value-based care success?
Yeah. Wow, great question. Yeah, it's like these questions really tee you up. I could probably speak for 20 minutes about this topic, right?
How about just answering one question?
Yeah. Let's see. Maybe I can answer this through a little bit through the lens of the problem statement, or speaking to some of the challenges that physicians, especially independent physicians, are facing in today's healthcare environments. I think starting from that standpoint, it's easier to understand where some of these value-based care enablement companies are looking to add value and solve for. So I'd say anyone that follows the healthcare space, this has been pretty well documented by now, but restating for good measure, right? Small practices typically don't have access to the same capital to run their practices, make investments in resources and infrastructure, very much overburdened with technology, or maybe lack of technology to help run their clinics. Fair compensation always in question, all sorts of pressures and new administrative burdens when it comes to dipping their toes in value-based payment models. There's a ton of burnout, right? More physicians than ever are retiring earlier, going the employed route. And, despite all that, we know that there's a ton of evidence out there that suggests independent physicians get great outcomes. They have strong relationships with patients. I've seen that firsthand. My mom works with an internal medicine pulmonologist who uses the Elation platform, and she absolutely loves her doctor. And I still remember getting a text from her one day saying, "Oh my God, I'm using the Elation app to communicate with my physician. This is great." And I was like, "That's great, but wow, mom, I didn't even know you could text." But point is, relationships with your doctor is so critical, and that can help drive adherence to care plans. Um, uh, we see that independent practices typically drive less readmissions to the hospital, get great outcomes, and that has a real impact on the patient experience and total spend. So I say that because it's more challenging than ever to be a physician. And that's a big part of the problem these groups are trying to solve, how to empower and sustain independent primary care medicine. And it's really at the crux, foundationally, what a lot of these networks are looking to do for its participants. So I'd tee that up. That's a little bit of maybe where these groups focus. And I think when you start to dig into the value that they're offering to physician practices and participants, one, I'd say, as I mentioned, physicians, struggle for capital, and these groups can bring more desirable financial arrangements to practices. It's like let's move this payment paradigm, join XYZ network, and move to prospective payments, a capitated model we hear about quite a bit. You're paid up front each month, a negotiated amount. Not every activity has to be directly compensable, right? This allows doctors to focus on simply what needs to be done to get the right outcomes, not just patients coming in, delivering X service and being reimbursed for it. And this can really open up the ability for longer patient visits, more face time with the patient. And for a small practice, a per member per month reimbursement model can be wildly helpful for budgeting. You've got much more predictability in your revenue, and usually it's significantly higher as well, an increase in total reimbursement. So, prospective payments are obviously just one example, but that's the idea. These groups can bring more predictability to the revenue, a more fair reimbursement for physicians for the work that they're doing, and that can have a big impact on the success of small practices. So, one, tied to kind of reimbursement, and two, these networks have access to significant capital for managing the health of the population. So, putting more of those dollars into primary care through how they're incentivizing and reimbursing the physicians, as well as all sorts of programs, whether it's care management, more coordinator resources, boots on the ground health coaches, behavioral health programs. I mean, there's just a lot more technology, right, to support practices. There's more access to resources and infrastructure to aid the practices in managing the care of their patients and really run their practices. So that's a big part of it. The ability to more fairly reward physicians for the care, and more resources infrastructure when you're coalescing groups of doctors together to drive great health outcomes. So that's probably a long-winded answer there, but that's probably how I'd speak to it.
Okay, so if I can distill this, what I think you're saying is that the transition from pure fee-for-service into value-based payment programs for independent practice is particularly difficult. It brings new kinds of work, new expectations, additional administrative burden on independent primary care practices, which are we need to be really precious about those. We're trying to protect those because they actually, we have good evidence to say that they are delivering better care and getting better outcomes. And it's really about protecting that physician-patient relationship. And so what these network entities do is they provide what we're going to lump into this concept of enablement that helps them with the technology, with additional resources, with better compensation, with predictive prepaid compensation that really unleashes these independent practices to be able to not only provide better care for their patients and jump off of that fee-for-service hamster wheel, but it also provides some economies of scale so that these entities can then, bargain better or negotiate better with payers to get into better contracts for them. Does that sound right?
Absolutely. Yeah. No, I think you probably did a great job in about 20 seconds summing up my much longer response.
No
Yeah,
worries.
no, you hit the nail on the head. Yeah.
Okay, good. So you mentioned your work in Hawaii, having to do with Elation and partnering with a risk-bearing entity. So curious about that. Like, what did you learn there, and how has that influenced Elation's involvement with other enablement groups?
Yeah. Yes, that was very exciting work. It was an incredible opportunity. Very hard work. I'm sure there were times I wanted to, put my head through the wall, but but incredible opportunity, and
If
I
it were
learned
easy, everyone would be doing it.
exactly right. It's always a roller coaster ride. Um, yeah, I know learned so much. It was an incredible opportunity to connect with so many small practice physicians. Many of them are our customers there in Hawaii. We work with over 400, physicians there. I think half, maybe more of Hawaii's population has a patient chart in Elation. So, we have really good coverage there. And it was just such a different dialogue than, Elation is a technology company. Many of our conversations with small practices are focused around the technology in the clinic. And sure, we're having a conversation around maybe the challenges they're facing, or some of the business aspects of running a clinic, but it's very focused around kind of the clinical workflow and how an EHR um, can plug in. And these were much different conversations around the business operations of the clinic and care delivery and payer contracting uh, foundationally to the origins of why these physicians were in practice in the first place, wanting to focus on delivering great care and introducing a true kind of medical group model. That grabbed the attention of a lot of physicians when sometimes they don't feel like they're being heard. And like you said, they're just kind of this hamster wheel, stuck in a hamster wheel. And being part of a group that can, provide them more resources to relieve some of the administrative burden in some very advanced payment models there, and improve how they're reimbursed more fairly, more predictive. Um, that was very interesting to a lot of doctors, and those were really fun conversations to have. So yeah, it was a great opportunity. Gosh, what did I learn there? I mean, probably so much. If I could distill it down, I would just say one, you know, trust. I mean, it's probably a very obvious thing. You need trust, but it was very clear that um, in some ways, especially when you're having conversations about something new, um, introducing kind of a newer concept around kind of a true delegated physician-owned, physician-led group model. It was like a new concept for the community, and without being able to build and establish some trust and achieve the goals we wanted to achieve there. So, trust, it shined a light on how important that is. And, I'd argue Elation has done a good job of that. Um, uh, but still always, more. Um, yeah, and then I'd say just delivering on what you say you're going to do. Trust is really sacred, and it's hard to earn trust, but it's can be very easy to lose it. And when you're meeting physicians face to face and in their clinics and looking in the eyes and say you're going to deliver and have a specific promise, it's important to follow up and execute on that. And I think sometimes that can get lost, and that's just really important.
Yeah, I mean, these are their personal businesses that they are putting on the
Yeah,
line, risking. So
sure.
that's
Very true.
not a small leap of faith. Um, so if we expand this to, other network groups that are doing this similar kind of work, um, what is their impact, do you think, on helping those
Mhm.
practices make that transition? Because it seems to me that, technology is a field of 1,000 blooming flowers, and in order to be successful, you correct me if I'm wrong, but in order to be successful for primary care, independent primary care to be successful in making that transition to value-based payment models, they need better resourcing and they need the right technology. They're not going to be successful without both of those things, I think. And so as we look at these, of course, we look at the one in Hawaii, and we help make them successful using Elation. But that's not necessarily going to be true for every independent primary care practice out there that's in a network group. So what's going on out there? How are these practices making that transition happen with the technology that they have? How are these enablement network entities helping them move forward and be successful?
Yeah, yeah. No, great question. Yeah. Well, first I'd say there's just immense opportunity. Probably one of the takeaways I had from the work in Hawaii, and piggybacking off the last question, but clearly huge opportunity space here. I know one data point I was just reading is that McKinsey came out with a study. It said like 90 million lives will be in value-based contracts by 2027. I think Medicare has openly stated they expect 100% of beneficiaries to be in value-based models by 2030. So the demand is only increasing and likely get more competitive, but it's clear value-based care is a huge opportunity space for these groups, combined with a lot of the challenges independent docs face. So, again, huge opportunity and a huge impact, ability to have an impact on our healthcare communities. So, yeah, so I guess uh, maybe a little bit of like where does Elation show up to help drive some value too? Is that kind of what you're getting at? Um,
Yeah, and what kind of technology do they need? Obviously, Elation is providing their brand of it, but there are other EHR companies and other versions of technology out there that are helping to drive value in these models. So, what besides resourcing, what does that technology, that tech stack look like?
sure. Yeah, well, I think anytime you have a group that is managing a population or accountable to care quality and outcomes, data is really, number one, to be important. And so, all these groups are going to have kind of a population health strategy that centers around aggregation of, uh, data being captured across the healthcare continuum. So, having technology to aggregate, analyze, um, and then help facilitate a lot of the programs to ensure that there's transitions of care and the high risk population and patients have access to resources is really important. So you maybe bubble that up, like kind of population health care management software is gonna be really critical. Yeah, and then, certainly an argument to be made around the value that an EHR can provide to the practice and the group that's looking to drive outcomes. So, you know, I'm sure there's a long list of other technology platforms we could dig into there, but I mean those would be two off the top of my mind that would be really, really critical, um, for sure.
So these network entities do help pull in the right data and feed that data to those practices so that they, for example, can identify those patients that need transitional care management or additional services because they have high needs or are high risk.
Yeah, no, that's, I think, the right answer there. At the end of the day, practices have big panels, and um, trying to run a business and make sure all their patients are getting high quality care, and having technology that can help identify which patients need what care, and then presenting that to the physicians in a very actionable, intuitable way, so they don't have to carry the burden. Um, uh, is really powerful and can really simplify the experience for physicians, to make sure that they're, again, being rewarded fairly and patients are getting the right care um, when they need it. And ultimately that can have an impact on healthcare spend and total cost, which is the end game, right?
Yeah, you mentioned earlier about Elation tailoring the workflows inside the EMR to
Yeah.
make some of this work sort of happen. Maybe you didn't say it this way, but that's how I heard it, by design.
Mhm. Mhm.
And what I see happening in the industry is that, you have a population health platform and you have a care management platform and you have various payers have their, quality metrics in, a registry that you have to log into. And all of these are, I heard it described on LinkedIn not too long ago as, physicians are asking for a chair and we're giving them 50 chair parts to assemble. And
Mm.
that really resonated for me. And so, as a physician myself, I know I live inside that EHR all day long, and I need the data and information and the capabilities to be natively inside that experience for me. I don't want to toggle between systems and have to double document and have fragmented information, et cetera. So, I really see that there's an opportunity there in the industry to bring those kinds of capabilities and data and information, and also turn all of that data into insights that you were mentioning that are actionable by the right person at the right time. So hopefully that's what
Oh,
Elation is doing to help drive value in this space.
I mean, absolutely. Physicians are logging into Elation every day to care for their patients. And they're using Elation the way it was intended to be used. A lot of systems out there may have physicians that have adopted it, but kind of half in, half out, right? And so, through that engagement, we have the opportunity to, partner and, take a lot of the outside insights that are being garnered and, dropping them into Elation where we can engage physicians in a really intuitive, actionable way, naturally in their workflow. Because it can be a huge burden for physicians to log into 10 different portals, or one system here to manage this population and then take action here, but then they got to figure out how to get it into this system to make sure they're not double dot. So there's a whole lot of that. And we've talked to so many doctors that find that challenging. And so Elation can be a really powerful source of truth um, to remove a lot of administrative and cognitive burden on providers, and centralize those workflows, and make sure that they're getting the insights in a way where it's really easy for them to say, okay, I can just take this action, know that I'm doing the right thing for this patient. In the back end, we're going to translate that to getting credit in this contract, this Medicare ACO quality measure, or make sure this chronic condition is being risk adjusted. So it's that's, yeah, really, really key to, I think, our value proposition there.
Yeah, and I mean, and I don't want it, we both work for Elation. I don't want this to sound like, a sales call for Elation on behalf of Elation. I feel like we still have a lot of work to do there. We certainly have not yet optimized this, but I don't think anyone has. And I think across the industry, we still have a lot of work to do to get to the point where we are really giving primary care physicians the tools that they need and the right workflows to be successful without extra aggravation, administrative burden, cognitive burden, that type of thing. So, how do practices find out more information about this if they're interested? Let's say I'm, out in independent practice somewhere in Iowa, and I want to look into joining a network because I want to get off the fee-for-service hamster wheel, but I can't do it by myself.
Probably follow our blog. Follow all of us on LinkedIn, follow me on LinkedIn, social media. This is my plug for the marketing team. And I think, definitely going to look out for more content. I think I'm trying to double check before I'm dropping all this here, but we've done some work last year to put together amazing learning content for our Elation employees around broadly the value-based care, value-based payment space. And I think we have visions of translating some of that content to make it more external facing, where we
Oh,
could
that's in
publish
flight.
that it is in flight. Okay, so I'm not okay. Okay, good. Look at that.
Coming
Perfect.
soon.
We have opportunity to publish more learning material and open up maybe a broader dialogue with our customers on where they can learn more, how to get involved. I see this quite a bit where we're customers of Elation, for example, that are using our technology, very happy with their partnership with Elation, and maybe are working with an ACO or thinking about joining an accountable care organization. And they may even raise their hand and ask Elation, kind of a trusted partner, their perspectives, or if we have any ACO partners. And so it's a great opportunity for us to be part of that value-based care journey for the practice. And, a lot of the work I'm doing is actively building stronger partnerships with physician networks, medical groups that also serve primary care physicians. And I think that's why I'm putting my sales hat on again here, putting a plug, but it's a big reason foundationally. When we think about the opportunity Elation has in working with these physician networks, we're foundationally aligned on supporting primary care. And I think that is so important that we're both serving that same customer. We want to help practices thrive. And that's very important in any partnership. But when you're philosophically, foundationally working towards the same outcome, solving a similar kind of problem space, that's just really critical to know that you're in the same boat, swim in the same direction. Um,
Yeah, and I
so
love
so yeah,
that concept
please
of
see
like,
more coming.
I love that concept of like the incentives are all aligned. Like,
Right.
institution won't be successful unless the practices are successful. And these network groups, the aggregators also won't be successful unless the practices are successful. And so there's a very symbiotic relationship there.
Yeah, I mean, for all the problems that these groups are looking to tackle, it's also very challenging to manage a large network of physicians that may be on disparate technology platforms. We've seen networks with maybe 100 to 150 practices that might have like 50 different EHRs being used across the network. And that can be challenging to support. And some of those doctors may be happy, and that's fine. Some also may be struggling. There's a lot of poor technology out there, and Elation can be a partner to help drive a higher level of satisfaction across the network and improve coordination and performance and stand up better, more robust data connectivity, and really help be a partner to drive success in these value-based contracts and high quality provider and patient experiences. So I think there was, I just saw this the other day and I heard this quote many times, but I was like, wow, I need to start using this more often. It's like perfect for what we're trying to do here. But, and I don't even know who says it. Maybe it's some sort of like African proverb, but it's like, if you want to go fast, go alone. If you want to go far, go together. Like, wow, it's like so true. It's exactly what we're trying to do with and building our partnerships with these like, kind of broad value-based care enablement companies and what we can do together with our provider partners. There's just so much opportunity there, like we discussed. So I'm excited at what we're building and everything that comes next, and more of these conversations. I'm actually hopeful, Sarah, maybe in a future conversation, if you're open to it, we could even bring in one of our partners, maybe an executive there, or a counterpart I may have at one of these groups to talk firsthand about their experience and how they work with provider partners and how we're working together to drive value. So maybe I'm plugging too much now, but I'll throw it out there too for
No,
future.
I think that's a great idea. It feels like we could go deep on any one of these conversations and spend, another 30 minutes just doing a deep dive because there's just so much to explore on this topic. So I think
Oh
that's a
yeah,
great idea.
and I'm probably not doing it justice. This is the tip of the iceberg here. So
Tip of the iceberg. So if you want to go fast, go alone. If you want to go far, go together. Love that.
that's right. That's right.
Well, thank you
Uh,
so much, Nick, for sharing your incredible expertise with us today. And as always, it was such a pleasure to learn from you. And yeah, I hope you'll be back.
Absolutely. I'm excited to see the Pulse thrive. So yes, please invite me back. Love to join.
Will do. All
Thank
right.
you.
So if you have questions or feedback about this content or have ideas for a future episode, don't hesitate to contact us at marketing@elationhealth.com. And thank you to all of you who tuned into our discussion today. We're really glad that you're here. And to learn more about Elation Health, please visit elationhealth.com. To access our webinars and Pulse episodes, visit elationhealth.com/resources/webinars. All other inquiries go to marketing@elationhealth.com. Thank you.